Thank you, Madam Chair, and thank all of the panelists here. This is certainly a very extremely important subject, but and I certainly support the legislation that we're discussing today, but I do feel like we need more time to work on some outstanding issues and to come to a mutually agreeable place. I've been a practicing pharmacist for many years, and I know firsthand and through personal experience as well, but also through professional experience that mental health is not a partisan issue. Mental health is a very personal issue and a very serious issue that we need to, and not only mental health, but addiction, and extremely important. And we have to address this in a bipartisan fashion, and make sure that we are getting everything right. I really do. I'm one who feels like the administration's done a fantastic job during the pandemic, especially of expanding telehealth. It's been said that telehealth has had 10 years of expansion in 1 week, and I think that's true. Before this started, there were almost 11,000 telehealth visits a week. Now it's over 1 million per week, and telehealth is here to stay, and it's something we've got to work on. I wanted to ask Dr. Evans and Dr. Geller, if I could. Both of you wrote in your testimony that Congress and the administration can do more to build upon the rapid success of telehealth. What can specifically we do to expand telehealth and the patient usage of this service as well? And I'll start with Dr. Geller.
One is that we can ensure that telehealth includes telephonic services, that is the use of the telephone as I've described before. The second is that we can ensure, as I believe has been mentioned previously, parity and reimbursement, that there should be no difference if a person comes to an appointment or if a person is seen through telehealth. Third, we should be putting in components to allow for collaborative care through telephonic and other electronic means. That is, for example, the psychiatrist is coordinating care with the primary physician, and that's a billable service. All those things would make quite significant differences as compared to what we had before COVID-19.
Dr. Evans, if I could ask you, one of the things about that we have come to notice during this and come to realize is the lack of health services in our rural and minority communities. How can telehealth help us in that respect?
Well, it can provide services to people who would otherwise not receive them. I think one of the other issues when you talk about telehealth, one of the things that we have to fix or to work on is the issue of providing those services across state lines. Right now, telehealth is limited and regulated by the license laws within the state. There are a few exceptions to that. And when you think about areas of the country where there are not enough practitioners and other areas of the country where you have an abundance of practitioners, one of the ways to solving the problem in rural and frontier parts of the country is to allow providers who are licensed to work across those state lines, something that we're working on at the American Psychological Association, and it's really essential for this to address some of the disparities that we see.
Thank you, Dr. Evans. Congressman Kennedy, I wanted to ask you, as I said earlier, as a practicing pharmacist and also as a pharmacist legislator in the Georgia State Senate in 2009, I sponsored the legislation that created our prescription drug monitoring program. So I'm very concerned about opioid use, and I think that we've done a good job of managing our opioid prescriptions for patients, but the lasting effects are still there. And what we've seen is that just recently in the last year, we've had overdose deaths have gone up 11%. Still, they've gone up 11% with everything that we've done in the way of addiction. And that's something that is very concerning to me. And I wanted to ask you, how do you think we can utilize telehealth to help us with to treat this and to treat addiction? And how can we encourage providers and patients to seek out treatment through telehealth?
Thank you so much for your question, Congressman. As you know, as a pharmacist, addiction is addiction is addiction. It could be opioids today, but it could be benzodiazepines tomorrow. And as you know, one of the real impacts we've never talked about in this hearing so far is benzodiazepine scripts have gone up over 30% since COVID hit. 30%. So not only has alcohol consumption far surpassed even very high rates. But now we have this. So as a pharmacist, you're seeing the full scope of what people are prescribed. That's crucial data. And so we narrowed it to opioid because it was the, quote, opioid crisis. But as we know, it's really an addiction crisis where opioids are one thing, but it could also include any number of other drugs that could also get people in trouble. So thank you so much, Congressman. It's great you're serving as someone with the experience that you're bringing to this effort, and keep asking these important questions. Telehealth can definitely help in a number of ways, and
Great.
Thank you.
Okay, thank you, and thank all the panelists, and thank you, Madam Chair, and I yield back.
The gentleman